Good morning, everyone. Whoever's joined us, we're just going to give it a few minutes for it to actually upload onto Facebook. This morning, we are talking to Dr. Hanekom, and he's from Aevitas Fertility Clinic. And thank you, Dr. Hanekom, for taking time out to do this talk with us. We really appreciate it. And it's so valuable to the women that's on our platform. We are almost 26,000 on the platform now, and it's women dealing with many different causes of infertility. And I think a few of them are actually your patient at the moment, some of your patients at Aevitas. So Aevitas has been around for quite a few years. Again, thank you for joining us. Maybe you can just give us a background about yourself and you know, what it is that you specialize in, as well as Aevitas Clinic and how long Aevitas has been around for.
Okay, thank you very much. And thank you for the opportunity. It's great to chat to you. Yes, so I'm one of 4 reproductive medicine specialists working at the Aevitas Fertility Clinic. We're situated in Pinelands in Cape Town. We've also got a satellite branch in the northern suburbs at Durbanville, where I also do consultations, scans, and surgery. I'm primarily a fertility specialist, trained, subspecialized in infertility, and registered with the HPCSA as a subspecialist. So all the other 3 infertility specialists at Aevitas. And then I'm also an endometriosis surgeon. So I do reproductive surgery, all forms of reproductive surgery, some of which we'll discuss now in this talk. And then also reproductive surgery, all of which we do laparoscopically. I myself was initially trained as a gynecologist in Bloemfontein in the Free State. And then I did my subspecialty training at the University of Stellenbosch and Tygerberg. And I've been working with Aevitas now for about three years now. So I'm one of the younger doctors at Aevitas. Aevitas itself is one of the oldest fertility clinics in the country. And one of our founding partners, Professor Creer, I'm sure everybody would know, with the groundbreaking work that he's done with establishing IVF in the country. And that's basically where this clinic started.
Okay, that's great. So today we're discussing blocked fallopian tubes, and not only blocked fallopian tubes. I actually want to touch on, there's a lot of women that's obviously dealt with ectopic pregnancies, or where their tubes has just been damaged. You know, so that I would think they would have to go through almost the same type of procedures when it comes to the fertility treatments that is offered to them. So what causes blocked fallopian tubes? If you could maybe just run down a few things that you know that would cause it.
So blocked fallopian tubes are, in our setting, is quite common. So there are a number of things that can cause blocked fallopian tubes. So the first one is previous surgery to the fallopian tube itself. So that's where a woman would have had a previous ectopic pregnancy, and that was partially removed, or previous tubal surgery can cause a blocked fallopian tube. There are also other surgeries in pelvic surgery also predisposes to adhesion formation, which can influence not only the patency of the tube, but also the function of the tube. So pelvic surgery or any abdominal surgery is a risk factor for tubal obstruction. Then infections is another big cause for us for blockage of fallopian tubes. Pelvic inflammatory disease or sexually transmitted diseases like chlamydia or gonorrhea are the big culprits that are causing fallopian tube blockage. But that also damages the internal structure of the tube, and if not causing absolute obstruction, can cause functional problems in the tube. So that is another big cause. And then endometriosis is also another big reason why fallopian tubes can get blocked. So endometriosis causes a lot of inflammation, and this persistent inflammation leads to adhesion formation. And these adhesions then in turn either block the fallopian tube or disturb dysfunction, which is also very important. So those are the main causes of tubal pathology.
Okay, so how is it confirmed or investigated? What procedure do you do to find out?
Yeah, so first of all, taking a thorough history is very important. So a lot of times, just by taking a history from the patient, you can already sort of ascertain whether she is at risk of tubal pathology or tubal dysfunction or tubal obstruction then in the extreme. So a proper history goes a long way. Tubal patency then can be confirmed then with what we call a hysterosalpingogram. And that is an X-ray then that is taken where a radio opaque dye is injected through the cervix, and then a series of X-rays are taken, seeing how this dye firstly fills the cervical canal, the uterine body or the endometrial cavity, and then going through the fallopian tubes and out through the femora into the abdomen. So that's called an HSG. That's usually done by your gynecologist in conjunction with a radiologist. So that's the HSG. Then we also can take patients to theater with a laparoscopy. Now, a laparoscopy then allows you to visualize the tubes to see if there are any adhesions, and then at the same time to once again inject the dye through the cervix and then visualize laparoscopically that the spillage of the fallopian, spillage of the dye through the fallopian tubes. What is nice is that at this stage, and we'll talk about the treatment, the laparoscopy affords you the opportunity to then correct the pathology if you see it. Then sort of a newer addition to this is something that we call a HICOSI, or that's a very ugly acronym for something that is actually called a hysterosalpingo contrast sonography. So that basically entails injecting a foam or a certain sonar lucent fluid through the cervix with a small catheter while you are performing an ultrasound, usually a transvaginal ultrasound. And then while the doctor is injecting this foam or this fluid, he can then on ultrasound see the filling of the cavity as well as the spillage through the fallopian tubes, which will then confirm the patency. We can also test for chlamydial antibodies to see if a woman has had a previous chlamydial infection. Chlamydia is, like I said already, the biggest culprit for tubal obstruction from an infective point of view. So if a woman tests positive for chlamydial antibodies, indicating that she's had a previous chlamydial infection, you need to seriously consider that the tubes might be affected. So that's in short sort of how we will test them and diagnose it.
Wow. So what is recommended? I don't know if you almost answered that question now, but what is recommended for blocked tubes? Is it the procedures that was done? Would that be, or would it be that the IVF would be the next step?
If blocked tubes.
Sorry.
Yeah. So if blocked tubes are diagnosed, I think it's imperative that the patient goes and sees a fertility specialist, because we are the doctors that have been trained in managing this and performing the surgery for this. And we need to make a decision whether this obstruction of this blocked fallopian tube is amenable to surgery. Because in a lot of cases, one can actually correct this obstruction and relieve this obstruction. So if as a rule of thumb, if it's more a distal obstruction, in other words, the femoral ends are blocked, then we can drain what we call the hydrosalpinx, which results from this blocked femoral ends. We can drain the hydrosalpinx and we can create a new opening in the fallopian tube and actually restore the fallopian tube's function. This is, however, very delicate microsurgery that we perform laparoscopically. So that's why it's necessary to go to a fertility specialist if this is your pathology. So yes, so the fallopian tubes can potentially then be corrected or opened, especially if it's distal pathology. If it's proximal pathology, in other words, closer to the uterus where the obstruction is, this becomes a little bit more difficult to treat surgically. And then one will often then go the route of assisted reproductive techniques if you cannot correct this fallopian tube obstruction surgically. In cases where the tubes were deliberately cut or ligated, like in women that had previous tubal ligation or sterilization, this is also possible, for us to restore this laparoscopically and to reconnect the tube and to create a patent tube for pregnancy to occur spontaneously. Okay. So yes, a blocked fallopian tube or damaged fallopian tube in a lot of instances can be repaired, but like I said, the fertility specialist needs to assess that for you and basically discuss the options, discuss the statistics, the prognosis of your fallopian tube, and then obviously reach a treatment plan which is the best for you.
Okay, that's great. So if there's one question is, if you've got damage on one of your fallopian tubes and the other one is still open, what are your chances?
Yeah, so usually we say and that you ovulate from the one side 1 month and the one side the other month. So obviously, when you ovulate from the side that the tube is blocked or dysfunctional, your chances of conceiving that month is less. So if you've only got one patent tube, what this basically will result in is what we call an increased time to pregnancy, because your ability to conceive then is decreased per month, or your chances to conceive then is decreased on a month-to-month basis. And therefore, you will find that definitely not impossible for these women to conceive, but it might take a little bit longer. Another option is then for your fertility specialist to track your follicle or to do ovulation induction and to make sure that you ovulate on the side that we have deemed to be open or functional, and then to optimize your chances in that month that we know you're ovulating on the side that is still functional.
Wow, thank you for explaining that. When you say things like that, it's actually, I think you to the right person that's listening, that's actually dealing with it, it's actually just giving them a bit of hope. That something can be done about it if you see the right specialist. We actually go to a fertility specialist in this case.
And I can't stress that more because people arrive at us way too late. Because right. One critical thing to this that I mean, we're not mentioning, but we should, is age, because age has such a huge role in our decision making as fertility specialists. Yes. How are you going to treat the fallopian tube also depends on the woman's age. So that's why it's so important, that your gynecologist refers you timeously, that you can reach the fertility specialist in good time, so that we've got time from a reproductive age point of view to treat you optimally.
Yeah, that's exactly what I tell everyone. If I think of my own situation where I was going to a gynecologist for 8 years, I think, and when I reached, I think it was 36, 37, he told me then, oh, you should be a fertility specialist. And I was like, why didn't you tell me sooner? And at the time, I never had the knowledge. And this is why we have Fertility Solutions, to try and encourage women to go at an earlier stage. At that point, I was almost too old. Not that I am now, but I mean, I was almost too old for to go through all the treatments and start the whole process from the beginning. So it's very, very important to seek the right help. Correct. I've got two last questions. Is, what if my tubes are removed? What procedure is then recommended to conceive? So if both tubes are damaged, what procedure would you recommend then to conceive?
Yeah, so after we've either establish that both of your tubes were removed, say maybe like from 2 previous ectopic pregnancies, or we've attempted a repair and we've found that we are unable to repair the tube, then unfortunately the only option for you that remain would be IVF, where we take the process of fertilization out of the tube. So remember, the tube is important for picking up the egg, for transporting the egg and the sperm, and fertilization takes place in the tube. So the tube is cardinal to conception. So unfortunately, if your tube is not functional or is absent, we've got no other way but to perform IVF for you. For a lot of women with tubal pathology, unfortunately, this is the best form of treatment because any tubal pathology will predispose you to an ectopic pregnancy if you fall pregnant, and like I said, increases your time to pregnancy. But yeah, if your tubes are blocked or have been removed, then unfortunately IVF is the way to go, where we totally bypass the fallopian tube and remove the whole process from the body. Very important, though, that once again your fertility specialist will be looking at your fallopian tube, and he might recommend that we remove the fallopian tube that are dysfunctional before IVF, because we've got very good data that shows that your success rate with IVF is decreased to as much as 50% in the presence of what we call a hydrosalping. So if you've got these blocked fallopian tubes, they often fill up with secretions and become what we call a hydrosalpinx, a fluid-filled fallopian tube. And this hydrosalpinx, or this fluid, is embryotoxic and influences the endometrial receptivity. So a lot of times we then counsel our patients that we actually go and remove these dysfunctional hydrosalpinges before IVF to improve the IVF chances.
Okay. And then does Aevitas offer this service to check the blocked fallopian tubes, and how do we contact Aevitas for an appointment?
Yes, most definitely. I mean, this is what we do. So we provide the whole range of diagnostic services, as well as then tubal surgery. We are, like I said, all trained reproductive medicine specialists with specialized laparoscopic skill that can do this type of surgery. So yes, by all means, the patient should contact us. Like I said, our clinic is in Pinelands as well as in Durbanville, and they can phone our offices or visit our website at aevitas.co.za, or phone our offices at 021 531 6999. So that is our address. But like I said, we're on the website. You can give a query there or get our number there and give us a ring and come and see us, please, because every woman is unique. Her situation is unique. The way we approach her fertility problem is unique. And there's such a lot of factors that play a role.
Okay, great. We actually had questions, and people's asking. I've got 2 ladies asking, where is the clinic? So I think they've just heard you.
And it's at Vincent Pallotti Hospital, so that's right next to the N2 as you get off the N2 in Pinelands, Vincent Pallotti Hospital, and then in Durbanville it's at the Durbanville Mediclinic.
Okay, great. The details are on our website as well as on our Instagram, Facebook as well. So thank you very much, Dr. Hanekom, for joining us. I really appreciate it.
Pleasure.
I think we'll see you in about 2 months' time, and I will send you an email to confirm that. But thank you for taking the time out to discuss this with the women and actually creating some hope. And I hope some of you, whoever's listened and is dealing with this, please contact Dr. Hanekom at Aevitas Fertility Clinic.
Excellent. It was nice speaking to you. Have a good weekend.
You too. Thank you.
Bye.